some question and answers from all of you. So if you're okay, I will share my screen and start with the presentation. All right.
Yeah, that's great.
Now, are you able to see it?
Yeah, that's perfect. Thank you.
Well, perfect. Thank you. So as the title says, community-based research in action, some harm reduction at the Mexico-US border. I wanted to put first some context, some personal background about who I am. Well, I'm from, for those of you who might know Mexico, I'm from Guanajuato, which is in center Mexico. I did my undergrad in political science and economics in Mexico City. And then from 2005, 2009, I work in the Ministry of Public Safety in the state of Quintana Roo, where Cancun is, where I work as a chief of staff. And my job was trying to help bring down federal projects into the local level, and trying organizations with local universities and other progress around public safety in the state. And it was during that time that probably some of you know that Mexico lived the first wave of violence. And that led me to want to, go back to school and try to understand why was this happening. Everyone was trying to say, like, let's look at the drug issues as a public health problem. So what was that? I was trying to figure it out. So I went first to study in 2010 to UCSD, where I did a master's in Latin American studies. And I focused there, my thesis first on violence as a public health problem, homicides in particular. And then in 2012, after I met some people at UCSD, I started a PhD in public health and global health. And my focus was really on trying to understand the police as a risk factor for HIV among people who use injection drugs in the city of Tijuana. I'll talk a little bit more about it. Then I did a small time in the British Columbia Center of Substance Use as a postdoctoral fellow, helping out the implementation of a drug checking program. And then work as a professor at CIDE and the NGO work here at the border. And finally, now my professorship at the University of Victoria. Some background for maybe some of you who might not know a little bit about what's going on with heroin. And I will focus more on heroin and not methamphetamine right now, because really right now you can see there in Tijuana, how the production of poppies is, well, all throughout the Pacific. And sorry for that part in Spanish, I didn't translate it. But then the routes of trafficking go through the northern part of Mexico. And these routes of trafficking that you can see there are kind of like what drives injection drug use in their country, which is simplified, for example, with this new study by Professor David Goodman, who I think is in UCLA School of Medicine as well. Some of you might know him. And it shows really that injection drug use is kind of like a northern phenomenon, but we see some red spots into the southern Mexico that might present warning clusters of heroin use. Now, I'd like to present this graphic as evidence one of bad drug policy 101. And this shows the heroin seizures from 1977 to 2019. And why do I present that? As probably some of you might remember, the so-called war on drugs started by Richard Nixon was really about heroin. And when he gave the speech to the Congress, Mexico was one of those countries when he mentioned that we had a problem in the production of heroin, of poppy, that is poison in our youth. And you can see in this graphic, and I like to show it because in the 70s, at the late 70s, almost 90% of the heroin that it was seized from the US government came from Mexico, that green color. And you can see how it comes down, and there are other places that substitute the production, Southwest Asia, general part of Asia, then the red, Colombia, South America. But then take a look at what happens to the late 2018, 2017. We literally go back to the same point where we were in the late 70s. So after all these years, the Mexicans are suffering, and also Americans, with the bad decisions of drug policy. So those kind of things is what drove me to trying to understand what was drug policy, how to look it up from a health perspective, and how to do something and engage with the community to solve these problems. So for some of you who might not know too much about the Tijuana, San Diego region, well, this border region has certain particularities that are shared with other areas around the world, but they're unique. So for example, you have open air drug markets, where you can see street injection and overdose happen regularly. So for example, that picture that you see over there to your right is an alley here in Tijuana that is close by one of the organizations that I work with, Prevent Casa. It also has a high number of vulnerable populations, right? We have people who use drugs, we have homelessness, sex work, a lot of deportees, recent migrants, and all of these combines in this ambience of high levels of violence and prevalence of HIV, Hep C that are much higher than the rest of the country. The same goes to substance use. We oversee higher rates of heroin and methamphetamine use compared to other places in the country. And as you can see there, and for some of you who might have the possibility to come to TJ or to Mexicali, really Tijuana and San Diego are kind of like one common area that is only divided by the border wall. We have this violence in the border. Part of them is fueled by methamphetamine and the dispute of the local drugstores. And what I mean local is really like the dispute for the corners. And it is reinforced by a militarization of the public security, by a lack of accountability of law enforcement, and basically because 95% of all crimes that happen in Mexico go impugned. So there's really been a lot of resurgence of violent crime in Tijuana. And just for putting it into perspective, Tijuana last year ended up with around 2,000 homicides in the city. The city is around 2 million people, so this gives us a homicide rate of around 100 per 100,000. That is astronomical if you consider it compared to a non-war state. The violence really is not everywhere in Tijuana. If you come over, and I invite you to come over, there are great food, tourist place, but it's really concentrated in the poor areas of town. And really what the narrative drives behind it is like, if you're engaged with organized crime, you'll have something to do with homicides. So meaning, the bad guys are the ones that die. The poor people is the one that die. But as long as they don't touch other parts of the city, violence continues to be like this. And I think, unfortunately, that we are getting used to this level of homicides, and it's not shocking anymore, which is what I consider one of the saddest part of Mexico nowadays. With the problem of drug use in Mexico, in early 2000s, and following up the experience with Portugal, which some of you might know, following the decriminalization of substances in the country, Mexico tried to copy this. And the first exercise was in 2005, when former President Calderon, who also started the militarization of public safety, or the new second wave of war on drugs, at the same time that they sent the military to fight the drug cartels, they also passed this decriminalization reform. It's really ironic in the sense that at the same time that you send in the army, you're trying to pass a progressive law that tried to decriminalize the minimum possession of some personal and immediate amount of drugs. So for example, he created this table. So if you are found on the streets by police officers, in theory, what should happen is that you should not be prosecuted for a crime. If you have less than 5 grams of cannabis, LSD, cocaine. So it shifted. The idea behind it is to prosecute this big drug dealing to the local level, to create a small drug dealing crime that they name narcomenudeo, basically small drug dealing. And then if you were found to be under this threshold, in theory, and this I'll explain why it means in theory, the law will indicate that you will have to receive orientation to receive treatment. And then in a bizarre way that maybe we copied from the United States, you had a 3-strike rules when if you fail for the 3rd time to really do something about your substance use treatment will be mandatory. But it was really a failed decriminalization reform. And part of the studies that I've done through these years, first in my PhD and now as a research in the border, had to do around how we have some laws on the street versus some law on the books, meaning it's not necessary that when you do a change in the law, it automatically changes the lives of the people who are on the streets. So for example, on this paper that you can find online, we evaluated through police statistics that really after the change in the law, there was no change in policing regarding drug possession. But really what drove policing in the city for almost 7 years was electoral times, meaning that when the elections were close by, police officers will pick up more people of any kind of crime, which it makes sense and is backed up by other theory from previous researchers where, you gotta be, you're tough on crime during election time. So from there, it came out something that I now try to do regarding my professional life, which is like we identify a problem, but now how do we solve it? And in that part, got together with two researchers, Leo Beletsky and Stephanie Stratti, both my mentors. And we were able to create a police education program. Basically, we train almost the entire police of Tijuana, 2,000 police officers on harm reduction, but above all, occupational safety, because we found that around 15% of police officers had stuck themselves with a syringe while they were doing their job, meaning that this was a behavioral, or sorry, it was an occupational risk of getting infected themselves with HIV or Hep C. So we developed this 3-hour model. We call it SHIELD or Escudo in Spanish, and we taught them basic epidemiology. For example, police officers, it was interesting. We had a doctor representing there in case there were some doubts. I had officers who had doubts about what it was HIV and how could we transmit it. For example, one officer said, let's say that I get stuck with a syringe right there. What if I cut my finger immediately with a knife? Will that stop the disease? You know, something about kind of like a zombie movie. So we found a lot of lack of knowledge about many issues. One also regarding the laws. They didn't know there was a law that decriminalized the minimum possession of drugs. And what it was unique is that we also did an evaluation of this model. We did a 2-year follow-up with the police officers to try to detect changes in knowledge, attitudes, and behaviors. This led out to some articles. So for example, you can consult these ones there on how to measure knowledge of drug policy reforms. We found, for example, that only 10% of police officers really knew 5 years after the implementation of the law, what was the limit of personal possessions for people. So not shocking that really the law is not being applied on the books, right? And then I did a transition on my personal life, and I moved from being a postdoc to then be a professor. And this led to an opportunity of how can we transform this classroom experience to the field? How can we, the interventions that we're doing in harm reduction, first, can we then community-based research, meaning that the organizations that we work with, the NGOs, the people who are there on the ground helping save lives are equal to us as researchers who have knowledge of the streets and who can provide feedback to our research, but also try to tell us what is really important about the research that we want to do. So this gave place to international opportunities for mentoring and collaborations that I welcome you all. If you want to do something down here, just like Tucker and many other people, please feel free to come down and we can see if your interests might align with ours. And what we were doing when we were working with these NGOs were several projects. One first was the detection of fentanyl. It was really around 2017 that we started hearing from the needle exchange program where we were doing needle exchange. And I like I mean, I don't go there every day, but I try to go there every week to help and learn. And with that humility of learning from the clients themselves that were telling us, you know, the dope that we are testing or that we're using right now is stronger than we were used to. Something is happening and we don't know what it is. And it was at the same time that Mexico City investigators funded by the US government wanted to know more about fentanyl. I had not a lot of idea about this. There were some experiments that were conducted in Canada. So in order for us to understand what was happening, we started doing drug checking from our own interest. So we could understand why these overdoses were happening, trying to understand these dynamics in the local drug market, and then gave place to the second step, which is overdose prevention, right? How can we bring naloxone to the field? How can we collect data to generate evidence? And how can we generate new harm reduction strategies, right? I want to say this is also drug policy absurdity 101. Naloxone is a medicine that in the US a long time ago, and depending in some states, it was only prescription only medicine. So in Mexico, it's kind of like the same. It's treated almost as if it's an opiate for hospital use as fentanyl. So you cannot really get it on the ground. The pharmacies don't have it. Sometimes the hospital have it, but only use it for surgeries and things like that. But there's really no distribution on the community level. And with that in mind, we had to start getting donations, aka smuggling from the United States, Narcan, so we can deliver it to the clients and people wouldn't die. So in this absurdity of drug policy in the world, we have to smuggle life-saving drugs from the United States, while organized crime smuggles heroin and methamphetamine to the other side. One must wonder when these things happen, if we shouldn't change things. So then gave place to trying to bring over some research. And we start with two exploratory studies. One is around the introduction of illicit manufactured fentanyl in the streets of Tijuana to trying to understand where it was happening, or like where do we need to bring more resources to prevent overdose. And the second, trying to understand more about safe consumption that I would explain a little bit later on. So how did it work first with this fentanyl drug checking? First, we started the first testing in the summer 2018. Like I say, a suspected report from a client and is really strong. So we started using paraphernalia, basically the trash. You know, sometimes people are scared of handling drugs. And in our setting, what we wanted to do is understand the dynamics behind. So what we started doing, and it was like something that it was used in other sites, more complexity, but we adapted to our reality. So we started just basically testing trash, meaning the wrappings or discarded syringes, to trying to understand and identify hotspots for increased risk of overdose. The idea is to have a new sampling mechanism and have this be able to conduct in the long time, so we can try to develop these strategies to prevent overdose. And then at the same time, we started a project in the city of Mexicali around safe consumption site, but we started noticing in the summer of 2019 that people were also reporting high number of overdose, and their dope was stronger than what they told us from the past. So we replicated the same thing, and we started testing in a little bit of a different context, this time in a context of a safe consumption site, their dope, so they could be safe if they wanted to use our site, or at least they have the knowledge of what they were using. So this is a part of the process of how do we learn for the health practitioners on the ground to incorporate it into our research, right? So for example, some key takeaways that we have from there is that how do we disseminate these results in a place with high violence, right? If you have, for example, places in Canada or in the United States that conduct drug checking, they have monitoring, they have publicized their data. But in a place like Mexico, where organized crime has a lot of interest, sometimes we need to find ways to disseminate the information in such a way that it doesn't bring additional danger to the people who are already doing the work. Once again, we got to put ourselves in the steps or in the feet of the people that we're collaborating with, and wonder what is safe for us to do of research. And it always should come first, the needs of the organization, follow up by the needs of the researcher. The other topic is, well, we brought these fentanyl testing strips, but they're not available to buy in Mexico. And we had tried, for example, to mail them the same that we did with Narcan, and it gets confiscated by Mexican customs. So how can we find a legal way to bring these needs or these materials that are basically saving lives to Mexico? The markets, we learn, also changing. You know, black tires mixed with fentanyl is more common now. And unfortunately, there's no way sometimes to avoid fentanyl because it's just laced in the local substance. And then something that is, I think, unfortunate is how the government stole the message. We found through the publication that we did of the detection of fentanyl, that fentanyl was in here in Mexico. So the government created this campaign that you can see to the right, which is fentanyl kills, right? But that's not an answer. Scaring people, we know, is not an answer. It's not that fentanyl kills, it's that the lack of government of safe drug policies kills people. So unfortunately, they hijacked this message, and now they're promoting just say no, which, as you probably know, is not the best solution. So now we jump into a second topic of the implementation size and computer-based research, which is a safe consumption site. So in 2017, I was approached by an organization in Mexicali, since they heard that I had been around for a couple of years trying to solve the idea of creating a safe consumption site in Mexico, and they wanted to do one. We were able to convince the Federal Ministry of HIV, SENCIDA, to finance the program in 2017. So they dedicated some money to help us set it up. So in 2018, we created this whole wave to trying to promote the service. We had, for example, created, you see it in the center, an article where we proved the attitudes of police officers in the city nearby in Tijuana was positive for safe consumption sites. We created this commentary in the Lancet about the need to create safe consumption services. And then we adopted the models from Canada. I've been around the world learning about many of these types of safe consumption services, but in that moment I was in Canada, and they have developed an interesting model that it was peer-based on an overdose prevention side. And we developed ours following those lessons from Canada, but we also made one big incorporation, which is we decided that our site was going to be exclusively for women. And around the world, around 120 places, such as these safe consumption services or overdose prevention sites, but only 4 of them are exclusively for women. And we can talk about that more in the open dialogue that we have. And then we created this active research to try to also help support, because unfortunately, after in 2017, the federal government pledged and gave us money to create the safe consumption site. The new incoming government in 2018, the federal government, leftist federal government, decided to stop funding all civil society organizations in the country. These included all the harm reduction services in the country. So right now, we have no syringes at times. We don't have money to pay the staff, and we rely on this collaboration with researchers to keep it going. It came out on the news. In English is better than it was in Spanish, like Mexicali offers safe spot for heroin addicts. I would have put it a little bit different, but it was better than the Spanish one that basically said like underpass for junkies or something like that. It said in Spanish. It was something like lugar picadero legal. That's what he said, like a legal shooting gallery for addicts. And obviously this was not good publicity, so they shut us down the next day. And we were in hiatus for around 6 months. And then we were able to open again in the beginning, like around April, May of 2019, under this kind of like don't ask, don't tell policy, where the government knew we were there. We were not going to publicize what we were doing, but they would let us just run the services. And then we have been able to finally start getting some evidence with Professor David Goodman. They just published this recent article about the impact of an overdose program in Mexicali. You can find the data